This video is designed to help patients in Saskatchewan learn about the important things they need to know before and after a total joint replacement. The video lessons and steps outlined by the Saskatchewan Hip and Knee Pathway are designed to help patients through the process of the surgery and onto a healthy recovery. In this module, you will get an overview of the Saskatchewan Pre-Surgery Checklist, what a coach is and why it's important. This module also covers the important facts about pain control and anesthesia the day before and after the surgery.
We really encourage a coach, right? So bring someone with you that can help you out, because of course you're not going to retain all the information that everyone's telling you. So if you have a family member or a spouse or whoever that's going to help care for you after surgery, going to drive you home, it's important that you bring those to these teaching moments.
People need to be aware of what they're facing before and after surgery.
The coach is very important. They are your main cheerleader for this whole process. They've been involved with your process preoperatively, during your hospital stay, and also when you go home. They will also be possibly the person driving you to follow-up appointments with your doctors, your physio appointments, that type of thing. So it's a major support person for the process, and it really, really helps the individual, the patient, come through with their rehab much in a happier place.
I think a coach can be very important because they can either help prepare some meals or help do the grocery shopping, help to plan ahead so that it makes it easier for the person that if their mobility is limited, that they have someone there to help.
It's very important to have your equipment ready. Ensure you've obtained your equipment that you'll need. Ensure that this equipment fits, particularly in the bathroom. And ensure that you've practiced using the equipment, such as the walker, the tub transfer seat, and a commode chair. You'll also want to use this time to ensure your home is ready and safe by installing railings on all sets of stairs, both inside and outside. You'll want to remove loose cords or throw rugs so you don't trip on them. Another thing you'll want to do is practice the exercises in the booklet you were given. This will get your leg familiar with those movements, and you will gain confidence and experience in doing these exercises. You'll want to make sure that you understand the instructions you were given at the pre-assessment clinic by the doctor regarding your medications. Review your instructions.
Make sure that you're receiving adequate servings of protein, which are found in the Meat and Alternatives group from Canada's Food Guide every day. So you're aiming for 3 servings per day. Another food group that's also important that supplies protein as well as calcium is your Milk and Alternatives food group. For that increased protein need, you should be aiming for 2 to 3 servings per day.
Planning and freezing meals before surgery is also important. It helps you to eat healthier once you get back home. Some things to look for are meals that freeze easily in individual portion. And also remembering to ask your grocery store about delivery services for groceries. Often that's available.
Nutrition plays a really critical role in the healing from any kind of surgery. We know that poor nutrition causes longer rates of healing. It can cause dehydration as well, which is definitely going to hinder your recovery process. So we really need to make sure we're getting good balanced nutrition at this time.
Skin preparation by showering twice before surgery is important to reduce the risk of infection by reducing the bacteria on your skin.
Remember to shampoo your hair, trim your nails, and remove any nail polish.
It is important to have an empty stomach before surgery by fasting because anesthesia can weaken the systems that keep food and drink safely in your stomach. Serious problems can arise if food or drink find their way out of the digestive system and into your lungs. Be sure that you have a bowel movement. If you suffer from constipation, take your usual laxative 2 days before surgery. An empty bowel before surgery helps avoid discomfort, constipation, and other problems. Now, if you develop a fever, infection, cold, flu, gastric symptoms like diarrhea before your surgery, please call your surgeon. This may mean your surgery has to be rebooked.
So when you come for surgery, it's important that you have your coach with you, that you have a ride to the hospital that morning, that you have arranged for someone to take you home when you are discharged after surgery.
An intravenous will be started in one of your arms. You will be getting an antibiotic within an hour before your surgery just to prevent any chance of infection. You'll be taken to the operating room. They will be doing a surgical safety checklist. You'll be given an anesthetic and then the surgery will begin.
The two major options that are available are the general anesthetic, where they are totally asleep. They do have a breathing tube put down their throat after they're asleep. The anesthesiologist is with them at all times during the surgery and administers IV medications and narcotics to them before they're awake, so that they wake up as comfortable as they can be when they are arriving in the recovery room. The other option is the regional anesthetic, or what many have heard called the spinal. Because essentially the spinal anesthetic numbs you from your upper belly down to your toes.